Is Melissa Dowling / Kenner for school purposes, doing my informative speech for speech class. Attending is my new husband and my audience of one, Robert.
Hi.
My speech is going to be on lupus, and the reason I kind of chose the subject is because I do have two friends who suffer from this incurable disease. So first, let me say thank you for coming. And what I'm going to attempt to try to do is tell you briefly about what lupus is, who's affected, the signs and symptoms, and then if there's any treatment possibilities. For those of you who don't really know what lupus is, it is a potentially serious and fatal disease. So let's jump right into what lupus is. Lupus is an autoimmune disease that becomes hyperactive, and then it begins to attack the healthy tissues. Thus causing several and sometimes severe symptoms. There's no single test to diagnose lupus. However, there are 11 different areas that doctors do look at, and if a patient tests positive for out of those 11 areas, then they are then diagnosed with having lupus. Some of those areas that are looked at are photosensitivity, blood disorders, renal disease, neurological disorders, and tons more. So now let's look at the different types of lupus. The first lupus I want to discuss is called discoid lupus, and what that does is it does affect the skin, and here I've got a picture to show you what discoid lupus looks like. You have to be kidding me.
You sat on it.
Here is a picture of what discoid lupus would look like. You can see that the fingers are a little bit red and kind of irritated. And then the second lupus that I want to get into is called drug-induced lupus. And that is actually caused by a reaction to prescription medication, and this is what a drug-induced reaction would look like for lupus. And then the last type of lupus would be the most fatal lupus, and it's called neonatal lupus, and that occurs when the mother passes on the autoantibodies onto her fetus. According to the Lupus Foundation of America, there are 1.5 to 2 million different people that have some type of form of lupus. 9 times more women tend to be diagnosed than men, and the diagnosis usually occurs between the ages of 15 and 45. Now we're going to get into how lupus affects your body and some of the symptoms that you can look for. Lupus does affect your skin. It affects your joints. It can affect your heart, your kidneys, your lungs, your brain. And then we get into what the symptoms are. As far as it affecting your joints, you may feel achy, like as if you had arthritis. You can have swelling of the hands and feet due to kidney problems. You can have fevers of more than 100 degrees. And you may also suffer from extreme fatigue. And then there's also the possibility of having some type of seizure associated with this. Back in 1948, the only treatment medication actually back then was aspirin. And then in 1955 they came out with 2 more medications, which were steroid type medications. And as of today, 56 years later, now we have a new medication called Benlysta, which is an attempt. What it does is it attacks the B lymphocyte stimulator protein, which is what they believe is the problem with lupus, and helps to get rid of those abnormal B cells. And that Benlysta is actually for patients who are already receiving some type of lupus therapy. So before we go any further, is there any questions that you might have? You're supposed to ask me, what is lupus? What causes lupus?
What causes lupus?
Doctors don't really know what causes lupus. It's said that lupus is genetic because they're finding that it's running more in families than anywhere else, but there are some environmental issues that could also bring on lupus. So if there's no more questions, in conclusion, what I hope I've done is give you a little bit of information and some knowledge about what lupus is, who's affected by it. It's not just men or women. Both need to be checked. So if you have any of the signs or symptoms, or if you know anybody that has the signs or symptoms, I would advise them to seek medical attention immediately and not wait.